Hello, healthy women. How are you today? Hope you're all doing great. Today we're going to talk about ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is a pregnancy where the ovum, the fertilized ovum, implants outside the uterus, most probably in the tubes, in the fallopian tubes. This occur in less than 100,000 of women in Nigeria per year. What could be the cause of this life-threatening event? You know, it could lead to life-threatening blood loss, and it's an emergency. It's a medical and gynecological emergency that should be treated immediately. What are the causes? What causes ectopic pregnancy? We can't really say what exactly is the cause, but most times it has been linked to an infective process that occurred sometime in the life of the woman, either due to sexually transmitted infection, inflammation that resulted after that, and leading to pelvic inflammatory disease or chronic pelvic pain. This infection could lead to adhering of the fallopian tube peritoneum to the pelvis, and this will impair the movement of the ciliary movement in the tubes. And when ovulation occurs in the tube, it will be difficult for the fertilized ovum to migrate on time into the uterus for implantation. So during the slow movement of this tube of the ovum, it could implant in the tube. And you know, the tube is so tiny, it cannot take the pregnancy. And so as the ovum starts to grow, the tube gets burst, and then the woman starts bleeding. So what are the signs and symptoms that occur? There will be a sharp pain on the side where the ectopic pregnancy occurred, because we have both the right and the left side, so it could occur on any side. After the sharp pain, there's usually a fainting attack, because sharp pain signifies bleeding from the side of the tube. And of course, when the bleeding is so significant, the woman now starts feeling faint, and then she may collapse. We had an incident yesterday in the clinic. The woman came down from a motorbike. Immediately she stepped down, she felt a sharp pain on the right side and she fainted. So the medical personnel quickly ran out and took her to the emergency unit. So what happens after the fainting spell? You know, once we check the blood pressure and the pulse rate will become very high, and then the blood pressure will become low. And of course, this woman will need a quick setting of her IV line with very large bore cannulas, where we start giving her intravenous fluids. Immediately we ask the relatives to donate blood, and then we rush her into the theater for emergency surgery. During surgery, most findings will be blood in the peritoneal cavity. So you see a lot of blood loss, up to 3 liters, sometimes 4 liters of blood already in the peritoneal cavity. And then we look at the tubes, which one is affected. So the affected tube is clamped and the bleeding is stopped in a surgical procedure we call saphenjectomy. If it's going to be through the laparoscopic technique, then we could decide to do a saphengostomy or saphenjectomy, depending on the findings during surgery. So what do we do about the risk factors? You know, I've told you that infection can be a risk factor to ectopic pregnancy. So we talk about prevention. Prevention involves having healthy lifestyles about sexual intercourse. Don't have multiple sexual partners, and then avoid sexually transmitted infection by the use of condoms and healthy lifestyle. And then once we notice those symptoms and signs that we talked about earlier, let's present to the hospital on time, where the ultrasound can be used to detect the ectopic early, because a lot of women they just know they have symptoms of pregnancy. They have nausea, vomiting, then they have breast fullness, early signs of pregnancy. But as early as 4 weeks, where the signs are not even present, a woman can be detected in the hospital through pregnancy tests or the test of using what we call HCG. HCG level that rises less than 35% of the normal value every 2 days is considered to be suboptimal and a sign of an abnormal pregnancy, which will now be checked to see if it is ectopic or other forms of abnormal pregnancy. So treatments, apart from the emergency situation where you go for surgical treatment, can also be medical, depending on the symptoms and signs the patient have, and if it is not life-threatening. Some natural preventive measures that have been seen in literature involve your diet. When you take garlic, turmeric, and some herbal drugs they call Lodra, has been found to help prevent blocked tubes. And then this could be a form of supplement for women who have had one ectopic pregnancy before and are willing to get pregnant. And of course, lifestyle changes, avoid situations that will lead to sexually transmitted infections, and avoid situations that will lead to pelvic inflammatory disease. So during sexual intercourse, try to use condom if you are not planning to get pregnant. So this will prevent you from sexually transmitted infection. And then in your diet, take plenty of fluids, take garlic, turmeric, herbs that have been known to help increase movement and circulation in organs. So I want my healthy women to always stay healthy, be observant. Once you notice any abnormal signs or symptoms, please present to the hospital on time, because once the ectopic is detected on time, it will be life-saving, because you will lose less blood and then you receive adequate treatment. So let's keep safe, let's keep healthy, and take care of yourselves.